Some of us are quite old school where we feel like we need to be in front of a doctor no matter what. How do you kind of make them feel comfortable with the idea of it's okay to be on video?
Yeah, I mean, again, as you said, it depends on what their problem is. Most patients think that when you see a doctor, the important thing is the physical exam. As physicians, we all know physical exam is usually one of the least important things. I take care of patients who ate peanut a month ago, had a reaction. They want to know what to do about it. They're not eating peanut today and having a reaction, so what am I going to see? They had hives last month. They don't have hives today. Their nose was running during ragweed season. It's November now. Well, it's not November. It's actually still ragweed season, but let's say it's November. Their nose isn't running anymore. There's nothing to see. The physical exam usually is not all that helpful, and most physicians realize that pretty quickly. It's really just talking to the patient, getting a good history, answering the questions, having a dialogue with the family, seeing what medications they've taken, what's worked, what didn't work, and trying to move forward with that. The physical exam is kind of an afterthought. There are times when I almost forget to do it because it's just so irrelevant to what's going on. Obviously, if they have a rash and they want me to look at it, I will definitely look at the rash. I always do a physical exam because it's what's expected. But if it's a telemedicine visit, you really don't miss anything because there's not usually anything to see. And I think patients have become a lot more comfortable with that now than they used to be because telemedicine has become just the way medicine is practiced. People are getting used to it now. So I don't think that we're missing anything, at least in terms of diagnosis, in terms of making recommendations for treatment. The only time the telemedicine would probably not be a useful tool is if you're doing a procedure. So if somebody wants an oral challenge to see if they're allergic to peanut and we're going to give them peanut, I probably shouldn't have them do it at home while I'm watching because then they have a reaction and I can't reach through the screen. It doesn't work too well. I can't do an allergy skin test if I'm doing telemedicine because there's a screen between me and the patient. We can still do a blood test, though. I can order the test. They can go to their local lab and we can get the answer just like we would, sort of depending on what the patient needs and what the purpose of the visit is. Telemedicine could be a completely appropriate thing. If there's a procedure that requires something to be done or there's a risk involved, that would be the time when maybe an in-person visit would be necessary. That's just kind of the way I see it. And the patients seem to be accepting that a lot more now than they were before because they're just used to it.